Hello there. Welcome to my show, COVID-19 Update by Heerak for October 5th, 2020. This is Monday, first Monday in October. And today is National Child Health Day. So you see the picture of a doctor and a child. Um, and many of you have children. Majority of Americans have children. Um, they really care about their child and love their child, and they want their children to have children so they could see their grandchildren. So this is just part of normal life in America and around the world. Actually, people work to feed their children. People celebrate their children's birthdays. Parents' lives revolve around children, um, not only when they're young, but even when they're adults. And that is the case in India. And you're hearing sitar music from India in the background, as well as in the United States of America and Korea. Uh, Children make the world go around, especially for parents. Most parents say that having a child was their most special experience in their life. Their happiest moment in their life is when they had their child. Most fathers say their happiest moment was when they um, saw their child come into the world. And many fathers have renewed love for their wife when their wife has a child. And children bond parents and hold marriage together in most cases. Without children, some of the marriages would fail. Children are the glue that holds the family together. And we see the struggle of women who cannot have children in the story of Hannah in the Bible. And Hannah was loved by her husband, but she wanted a child. And she prayed to the Lord and wept and wept. And the priest thought she was drunk and accused her of being a drunk woman because she was weeping and crying and yelling and praying to the Lord. But God answered her prayer and gave her a Samuel. And she dedicated Samuel to be a prophet, uh, to be a priest. And Samuel was trained by Eli to be a priest, prophet. Um, yeah, but obviously she got pregnant because she bargained with God to dedicate her child. Generally, God wants bargaining. God's not just going to give you what you want. You have to give God something. It's like God's asking you what's in it for Him to give you a child if you're barren. You have to promise God something. You can't just say, "Give me God, give me a baby. I'm barren." God's not going to give you a baby. You have to give God something. As I said to you many times in this show, COVID-19 Update by Heerak, it's a daily show. Um, God is a transactional being. He never gives you something for nothing. He wants something in return. When God made covenant with Abraham, it was a bilateral contract. God promised to give Abraham a child and make his nation great. Uh, in return, Abraham had to promise that his descendants will be circumcised and that they'll follow the Torah, Torah Shekatu, the Ten Commandments. And when we talk about Torah, generally refers to the five books of Moses, Genesis, Exodus, Leviticus, Numbers, and Deuteronomy. So the condition for God blessing Abraham and his descendants, what we call Israel, is that Abraham and his descendants, or Israel, or Jews, must follow the Torah. So it's transaction. God's not going to bless Jews and Israel just without anything in return. they need to give God something. And the requirement was that descendants of Abraham, Jews, Israel, must circumcise all the children who are males, and they have to keep the Torah. In the event that they violate the contract, what we call Brit Olam, everlasting covenant, God will not give um, the nation of Israel or the Jews in the diaspora or Abraham's descendants the blessings that he had promised to Abraham to give, because there's a violation of the contract. So it's a bilateral agreement, it's a contract. Um, and so throughout history of Israel and Jews, we see tragedies that fall upon Jews in the diaspora, like in the Holocaust or being expelled from Spain as a whole people. There was an edict of expulsion of Jews in 1492, the year that Christopher Columbus discovered the New World. Uh, that required by national law of the land, to expel all the Jews from Spain. And Spain confiscated all the wealth, because Jews were the wealthiest people in Spain at that time, as a class, upper class. So they were forcefully removed from Spain, um, and they say the tragedies in Jewish history, like the Holocaust, um, and Jews being expelled from Spain, mirrored or paralleled Jews leaving the Torah or not keeping the Ten Commandments. And actually, Torah is Genesis, Exodus, Leviticus, Numbers, Deuteronomy, 5 books of Moses, not just the Ten Commandments. So it's kind of interesting, theologians, speak about this. And as you know, I'm a certified expert in theology. I'm a card-carrying member of the European Association for Biblical Studies, EABS, made up of leading experts on the Bible and theologians in Europe who teach at universities like Oxford, Cambridge, Geneva University in Switzerland, University of Paris in France, Heidelberg University in Germany, University of Berlin in Germany, the top University of Madrid in Madrid, University of Rome in Italy, all the top experts. So I'm a certified expert. And this is consensus. Everybody agrees that there's a mirroring of violation of Torah with tragedies that befall the Jewish people. And experts call that Deuteronomistic history. It's tragic, but tragedies keep happening throughout Jewish history from the very beginning until now, and it'll continue happening throughout the future. One dominant theme in Jewish history is tragedies. Yeah, it's not like that for all peoples, but for Jewish history, most experts of Jews agree that tragedy is the dominant theme of Jewish history. Tragedy that results in Jewish lives being killed by foreigners, that's the dominant theme in Jewish history. It keeps happening again and again and again. Like when I say, Jewish people being killed, not like individuals, but Jews as a people get targeted by foreign nations who carry out the executions, So that happened throughout history during, few decades after Jesus. Jews in Alexandria, the wealthiest people in Alexandria were Jews. They were killed en masse, and actually, great Jewish historian who's ethnically Jewish, obviously, Josephus, his nephew, was instrumental in brokering with Rome and Egypt the slaughter or genocide of Jews. Some people do all kinds of stuff for money, Uh, but yeah, he basically betrayed his people, and the whole community of Jews in Alexandria, all the wealthy people, they were slaughtered um, in a official government-sanctioned genocide. So yeah, these things happen again and again. It's just one example. Throughout history, it happens again and again and again. So they say the tragedy is dominant theme in Jewish history, and when you study the Jewish ethnic group activity at that time of the tragedy, or decades before, there is evidence that they were not following the Torah, Genesis, Exodus, Leviticus, Numbers, Deuteronomy, and so That is a recurring theme in Jewish history, and that's recognized by religious and secular and atheist scholars alike, because you just study the correlation, right? Obviously, Orthodox Jews, Hasidic Jews in like Brooklyn and Mia Shearim in Jerusalem say that it's not just a correlation, but it's a causative thing. You don't keep the Torah, then God will punish you. And I kind of talk about that theme in my play, Jewish Being, a play. So if you Google Jewish Being, a play, and type my name in, Heerak Christian Kim, you can see that play and you could read about it. I reflect on this conflict and within Jewish community where they discuss, tragedies in Jewish history. So I try to incorporate some of the internal discourse within Jewish communities into my plays, my short stories, and novels. So you have a look at it. Um, yeah, in 24 hours, recorded death is about 189, but yesterday was Sunday, so sometimes people don't always report on time. Um, yeah, but I mean that's definitely not true. I'm sure around 1,000 died yesterday as well. But like weekends, people don't always work. This is America. People go to church or people don't work. So you're always going to have some like lag time. So currently we have 209,857 deaths in America, and confirmed cases are 7,423,328. And I'm sure, if your parents, you have your children's drawings framed, you try to help your child learn like piano or some kind of ballet or some kind of skill, baseball. Mothers and fathers are very happy. Their happiness comes from their child. I mean, they go to work, they work hard, they come home and they see their children, and everything is worth it. Children make the world go around, and that's why today being National Health Day, Child Health Day is significant for all of you who have children, and all of you are children of somebody. So your parents, so everybody, it impacts everybody. Um, let's look at top five COVID-19 cases in the world. United States has the number one cases, 7,423,328, and we have the most deaths in America. So it's 209,857 deaths so far. Obviously, we're entering the flu season and the number's going to grow exponentially. It's going to grow like tenfold, over tenfold. Um, yeah. In the United States, we're going to have minimum 3 million deaths in the flu season. It's 6 months long. It like goes from like October to like April. I mean, it's 6 months. And it's going to grow exponentially. People are going to die, large numbers. Um, New York is trying to close down some areas. I think that's a good idea. I think you should shut New York down completely if you want to avoid millions of deaths. It's very crowded. Sooner you shut it down, you're going to have fewer deaths. Obviously, they can't escape having hundreds of thousands of deaths. Because even if you completely shut down, people die. Like New York completely shut down in March, and still in April, you had 30,000 die in 1 month. So even if you shut down completely now, and you have a death rate like after New York completely shut down in New York of 30,000 per month, 6 times 30 is 180,000. Minimum 180,000 will die in New York City at the rate of 30,000 dying during a complete shutdown. Like you can't go anywhere except like grocery store. And 30,000 die in New York. So even if you completely shut down, you're going to have minimum 30,000 dying after the shutdown. Now, April is like the tail end of flu season. So you can't say it's only going to be 30,000 deaths per month in New York, obviously, because height of flu season, more people are going to die. So it's probably going to be more like 300 or 400,000 people in New York will definitely die, even if you completely shut down. Don't let people go anywhere except like grocery store. Starting today, you're going to have at least 300 to 400,000 people die in New York from now to April. Well, I think we can safely make this assessment based on what happened in New York in August when the whole city completely shut down and over 30,000 died, right? Because it's going to be far worse this time. because in March, babies were not getting infected. Really, children were not getting infected. It was just the old people. But now, after April, we have children getting infected. Uh, Towards the end of April, there was one baby dying per day. And you can go back to my show and see that. And the flu season was over in basically by May. But now we're going to start from beginning for 6 months. So you can expect minimum one child dying per day on average in New York, like one baby. So 6 times 30 is you're gonna have at least 180 babies die from now until April in New York City alone. But it's probably gonna be far more than that. I mean, babies have died during the summer as well from COVID. Um, and that's just in New York City. Over 180 babies will die just in New York City. Over 180 babies will die in Philadelphia. Over 180 babies will die in Washington, D.C. Over 180 babies will die in Los Angeles. Over 180 babies will die in Miami. Over 180 babies will die in Chicago. Over 180 babies will die in Charlotte, North Carolina. Over 180 babies will die in Charleston, South Carolina. Over 180 babies will die in Detroit, Michigan. Over 180 babies will die in Boston. Over 100 babies will die in San Francisco. All those internet billionaires, everybody's going to die. Some of them. Over 180 babies will die in Atlanta, Georgia. Over 180 babies will die in Nashville, Tennessee. Over 180 babies will die in Mobile, Alabama. Over 180 babies will die in St. Paul, Minnesota. Over 180 babies will die in Cleveland, Ohio. Over 180 babies will die in Cincinnati, Ohio. Over 180 babies will die in um, St. Louis, Missouri. Over 180 babies will die in Wisconsin, Milwaukee, Wisconsin. Over 180 babies will die in Indianapolis, Indiana. Over 180 babies will die in Providence, Rhode Island. You get the point. I mean, I can't mention every city, but every city will have at least 180 babies die from now until May. That's expected because babies now can get infected, and that's what I'm calling New York virus. So your baby could die if you have a baby. And since June, now teenagers and 20-year-olds are now able to get COVID. If you could get COVID, you could die from it, obviously. In the summer, everything is kind of mild, but it's not like that in the winter. Everything is serious. So a lot of teenagers and 20-year-olds will die. If you're in a state with schools open, you can expect thousands of children to die from COVID and flu season. Thousands, maybe tens of thousands, maybe more. You will see that, because, and that's what I'm calling Florida virus. COVID-19 keeps mutating because originally it did not really infect children, like in January 2020. But it's mutated to infect children because that's what virus does. Virus wants to, its purpose for existence, COVID-19's purpose for existence is to infect as many people as possible and kill them as possible. So they're going to mutate so that they could infect more people, right? So how you're intelligent, you try to solve a problem, you apply to college. If you get accepted, you go and you try to get A's in your courses. You find a way to, maneuver through the system. Virus is the same. They are intelligent organisms. So when they see that they're not able to infect something, they start mutating. These are intelligent. Their intelligence is different from ours. We use logic to to um, to find answers generally, although we work from instinct as well. But just look at your dog or cat. You know, when when they want to go outside, they start scratching at the door, right? They try to figure out a way to get out. But they're not logically thinking like human beings, but they think instinctively to try to find an opening. And monkeys, they could also turn the knob. So depending on what kind of dogs won't have hands that can grab things, but animals that can grab things, they will, try different methods out to go out if they want to go out. In the same way, virus, if they cannot get out or infect the baby, they're going to try to figure out a way to infect the baby. And they keep mutating and they're going to fail several times. Like monkey trying to open the doorknob, he'll probably fail, several times, and eventually he'll figure it out and open the door and get out. And once he does that, he can always get out because there's kind of a memory, right? All living organisms have enemy and memory, and viruses are the same. They have memories, and so once COVID-19 figures out a way to infect a baby, then the virus will, the strains of virus, it mutates, right? And once it's mutated, it's going to spread with that mutation so that a lot of babies could get infected. And we saw how quickly that can happen in Florida and North Carolina and South Carolina. 20-year-olds were infected, thousands of them were infected. So once it mutates and it successfully infects the baby or 20-year-old, that imprinted memory becomes part of the COVID infection process, and then you have thousands, even millions getting infected. And obviously, COVID-19 was working hard to mutate so they could kill as many people as possible during the flu season that's coming, because they know, COVID-19 knows that they're weaker during summer, they're stronger during winter. I mean, obviously, all living organisms know. It's kind of like polar bears, or more like grizzly bears hibernating in the winter because they know they have to do that to survive. So COVID-19 knows too. Its purpose for existing is to infect as many people as possible and kill as many people. That's how they survive, right? From people to people. And that's the reason for existing. And so in terms of life cycle, they know that their life cycle, their purpose in life for COVID-19 is to infect and kill people. And so they know winter is coming, so they need to maximize their reason for existing before the winter season comes so they can maximize their purpose, right? And that's why in June you have multiple people getting infected, because COVID-19 is figuring out how to infect and kill more people in the winter, right? So they realized, COVID-19 realized from January to May, they weren't able to kill too many babies and children and people in their 20s. So it's worked hard to mutate so they could now kill, babies, children, infants, toddlers, elementary school kids, middle school kids, high school kids, college student kids, 20-year-old or college graduates, or those who are working. So, virus worked hard to fulfill its destiny. And the destiny of COVID-19 as a virus, killer virus, is to infect and kill as many people as possible. So they want to exponentially increase their pool of customers, or, they want to reach as much, it's like any kind of market research. You research to see how many people you can reach and what medium is the best way to reach so they can get people to buy your stuff. Well, for COVID-19, they're not interested in you buying their stuff, but they're interested in infecting you as efficiently as possible. That's how they're, so they're living organisms who know the cycle of life, who know the seasons, who know their environment, who know that if they're in the desert area, they have to adapt to the desert, who know that if they're in like Philippines or India, or, the countries with, same season, like same temperature, similar temperature, California, 365 days there. They know that they have to adapt to that to get infect as many people as possible. And obviously, COVID-19 is a killer virus. It's not just about infection. They don't want to just end that infection. They want to kill you, right? That's what COVID-19 wants to do. So if they see that they're not killing you after infecting you, they're going to mutate to do that. Yeah. So you're going to see constant mutation process of COVID-19 to fulfill their destiny. And that's why, I'm thinking more like 20 to 30 million Americans will die because they maximize their potential. Now, people who are like newborn to the very old can get infected. And that wasn't the case, except for a few exceptions in, in the first peak, which was like March to May. Now everybody can get infected, which means everybody can die from it. And so, COVID-19 has mutated. So I think we should expect at least 20 million to die. I mean, I'm saying minimum 3 million because 60,000 deaths per state will equal 3 million, and that's 100. I would say 99.9% guaranteed to happen. Um, but I'm thinking more like 20 million or 30 million will die. It's 6 months long. It's a half a year, right? Half a year, and you may not have the patience to lock yourself in for 6 months. In which case, your chance of dying is pretty high. It's kind of like if you have a tiger outside your cave. If you just stay inside the cave, elevated cave or tree for 6 months, you're not going to die. But you have to get down from the tree to get food. And when you get down from the tree to get food, you could die. You have to go to the grocery store at some point, and you get infected while going to the grocery store. You see what I'm saying? Um, yeah. So unfortunately, India is number 2 now. As you know, I have a lot of friends in India, and 6,623,850 people are infected in India, and 102,685 people have died. So, I mean, they're catching up. I mean, in terms of death, Brazil is still number 3. They're catching up to that, and Brazil is catching up to us. And we're continuously having a lot of death, an average of 1,000 per day. And it's going to spike up, obviously, with the flu season. But then every country is going to spike up. So Brazil has 146,352 deaths, 4,915,289 cases. Russia is number 3. And it's significantly lower than Brazil, 1,219,796, but they still have 21,375 deaths. And Russian winters are cold. So, I mean, they could really spike up during the winter as well. 6 months long flu season. Colombia, we have 2 Latin American countries now in the top 5. Actually, it was that way for a while, but Latin America is becoming continent of death, unfortunately. So we have 855,052 cases in Colombia, and 26,712 have died. And you got to remember, if your home country have a lot of these deaths, it kind of shows that you're vulnerable population. Like Indians in America, you're vulnerable to death during this flu season far more than, let's say, people from Sweden or Norway, because look at how many people are dying in India. Same with like Brazil, people in Brazil. Look at all the death. Look at all the cases. You have higher chance of getting infected, and you have a higher chance of dying if you're Indian or Brazilian. Yeah, you see what I'm saying. I mean, you have to study. This is why people study demographics, because demographics tell you in healthcare who's more vulnerable than others, right? We know Indian people from India, immigrants from India are far more vulnerable than immigrants from China to COVID-19 death because of the figures, right? And so if you're an immigrant from India, and there are 100 different nations represented in Arlington County in terms of residents who came from other countries. If you're an immigrant from India who live in Arlington County, you're at far more risk, number 1, to get COVID-19, number 2, to die from COVID-19. Those are 2 things that you have to understand. Same with Brazil. If you're an immigrant from Brazil, you have far more chance of getting COVID-19 and far more chance of dying from COVID-19. Because as you know, all the countries are trying to prevent COVID death. All the countries are trying to prevent COVID spread. But if you see from the statistics that some certain countries have high spread and high death, that means there's something about the demographics. Obviously, scientists have to study more in length and depth to see what is it about genetic makeup of people from India. Well, and so that's what they would study. And cultural anthropologists may study what kind of food do Indians eat, do they impact, and nutritionists as well. And this is why people study nutrition, right? What kind of food impacts your health in what way? But you need about 20, 30 years of research. So, None of the research in those fields, nutrition studies, um, will give you specific facts in the next 10 years. Because they have to do a lot of research and they study people over time, right? There are a lot of different food items. Not everybody eats the same food, although there are some food items that are similar. So, and it's hard to test nutrition and how it impacts health over a short period. You got to study over a long period. So what that means is India and Brazil, people from India, people from Brazil are going to die in large numbers in America. That's something you got to expect from this flu season. That wasn't the case in the first flu season. Not too many people died in India, not too many people died in Brazil, but COVID-19 strains in India and Brazil must have mutated to be very effective in fulfilling their raison d'etre, reason for existence. So COVID-19, just like people. Some people are smarter than others. Some COVID-19 strands are smarter than others. And obviously India seems to have like brainy, smart COVID-19 that's mutating to infect as many people and kill as many people as possible, right? Same with Brazil. Not all COVID-19 are not all the same. Don't assume that all tigers are the same, all monkeys are the same, all polar bears are the same. There are superior polar bears and inferior polar bears. There are superior tigers who can kill more, and there are inferior tigers who can kill less. You know, I mean, don't think like all tigers are the same. He's like, no, all human beings are not the same. All tigers are not the same. In the same way, all COVID-19 are not the same. COVID-19 in certain areas are much more smarter than others. And you could have smart clusters of COVID-19, like in India and Brazil, that fulfills their purpose much more quickly, infect and kill. Um, I mean, obviously you need decades to study this. What is it about COVID-19 strains in India that's different from COVID-19 strains in, um, Denmark? I mean, you need to study this, but how are you going to study this? You need decades to study. You're not going to find that out like right now. So, but one thing you do need to know is looking at the statistics, numbers don't lie. If you're from India, you have very, 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 very high chance of dying. That includes nurses from India, doctors from India, physical therapists from India, uh, you know, as well as people who work in grocery stores like 7-Eleven, so that's something you have to understand. So if you're from India, you should be far more careful. Um, yeah, and make sure you call 911 if you can't have problem breathing or you have heart pain, right? Go to the emergency room right away. I mean, everybody should do that, but a lot of people from India are going to die, so calling 911 is very, very important. If you're an immigrant from India, immigrant from Brazil, you need to tell that to your children and make sure you prepare for this flu season that's going to kill a lot of Americans. But yeah, I mean, disproportionate number of immigrants from India will die, and disproportionate number of immigrants from Brazil will die. That you can understand that by looking at the numbers. Numbers don't lie. You know, so it could be that virus has mutated more effectively in India, but also that your genetic makeup, whatever they are, or what you eat or whatever, researchers have to research that, make you more susceptible to COVID-19 infection and death. Um, yeah, it's going to be horrific in the winter. And two important articles in light of today being Child Health Day. And this is very recent. One article is from October 4th, yesterday. One article is from today. You need to pay attention to. And I thought it's important to focus on babies because many people don't know much about babies. Liberal media, as you know, I don't trust the liberal media. Liberal media doesn't really talk about babies that much, and they should. Because a lot of you are newborn mothers, you just had a baby or you're pregnant, you're going to have a baby. By the way, Virginia Hospital Center is one of the best hospitals in the country for taking care of newborn mothers and for helping you have your baby birth. So if you're pregnant, come to Virginia Hospital Center. As you know, I'm a RN nurse, registered nurse at Virginia Hospital Center. And so maybe you'll see me if they come to the hospital center. But Yeah. But yeah, I mean, those of you are pregnant or know someone like a friend who's pregnant or a sister who's pregnant or child who's pregnant, this is something that you need to pay attention to, and you got to make sure your child watches this show, so they're following along. This is very important. Because COVID-19 kills. One article is American Idol alarm Casey Good's newborn son test positive for COVID-19. So she says, please send positive energy. So you see her photo there with her baby. She's wearing a mask. Uh, and so this article is found in People, so you can read the full article there. Claudia Hermata, and that's October 4th, 2020. And the significant quote that you should see is American Idol alum and Instagram influencer Casey Good revealed that her newborn son, Maximilian, nice name, tested positive for COVID-19 or coronavirus. So, yeah, I mean, babies, we know babies can die. Um, yeah, hope that baby doesn't die. It's really cute. I mean, all the babies are cute, but the baby could die. And as I said, every city is going to have at least 180 babies die, one per day, at least. So there's high probability, high chance that the baby's going to die. But we're going to have babies who don't die. And the second article kind of shows two things. One, a lot of newborn babies in different regions get infected, and some can survive. Um, so second article is we need to continue fighting. How a Reno grandmother, this is state of Nevada, mother and newborn survived COVID-19. Three generations, grandmother, mother, and baby got COVID-19, and survived. Um, once COVID-19 enters your house, everybody can get infected, right? That's why you should, I'm telling you, you must stop seeing people in person. Stop socializing with people in person. We're entering flu season. This is 6 months. You could hibernate inside your home. If you don't have to go outside, don't go outside. I mean, you can walk around alone, but don't go to inside a restaurant or inside a cafeteria. Like, I mean, if you want to survive COVID, then you have to be careful because all it takes is one person to get it for your whole house to be infected. This is why I worked hard for 3 months to shut down every public school in Virginia's 8th district, Arlington County, Alexandria City, Falls Church, and Fairfax County, because if your child gets COVID, your whole house can be infected, and it's possible for everybody in your house to die from the infection you got from your child. That's why I worked 3 months to shut down these schools. An idiot Fairfax County school board members are trying to open up Fairfax County and kill people, in Fairfax County. It's ridiculous. Teachers are going to die if they have to go in and teach the children. And teachers, if they get infected with COVID, they could give it to their baby and their baby could die from it. I mean, geez, we're not just talking about one person, a student at Fairfax County getting it and dying. We're talking about student coming home and giving it to her mother, her father, her grandmother, her sister. Everybody could die. Teachers too. If you're a teacher and you're married, and you're at Fairfax County and they're required to go in and teach, you go in and teach. You come up, you could infect your 3 children that they could all die from the COVID you gave them. Don't do it. Don't go in. I mean, as I say, for Fairfax County school teachers, as you know, I'm a teacher, professional licensed teacher in Virginia. As I say, do not go in and teach if you don't have to. If you have money saved up, take the 6 months off. Go on leave of absence or whatever. Get pregnant and take the maternity leave and take leave of absence for the rest. Yeah, I mean, don't go in and teach. If you're a teacher in Fairfax County, are you crazy? You want to get COVID and die? And even if you're a 20-year-old teacher, you can go into Fairfax County and teach and die. Of course. If you have money, if you come from a millionaire home, this is the time to spend your money to survive COVID-19. Don't go in and teach if you're a teacher, especially if you're over 40 and have diabetes. Yeah, your chance of dying from COVID is very high. Don't do it. If you have money saved up, If you could take an early retirement from Fairfax County Public School, do it. You know, these idiots in school board, sometimes politicians, they ruin it for everybody. These idiots in Fairfax County School Board are trying to kill you by opening up schools. Why would you want to do that? Why? When you have technology where you could do 100% online, nobody has to die. I mean, some people will get infected still because you have to go, you know, go down from the tree if you're being hunted by a tiger and get food at some point, right? So like you have to go to a grocery store, like to Walmart at some point. Um, so yeah, I mean, you can still get infected while grocery shopping. So, you know, it's not going to completely get rid of COVID, right? Because people have to buy food somewhere. And there are essential workers who have to work, you know, like bus drivers, and, you know, so they're going to get COVID. You know, we're going to have people getting it and dying from it. But we want to reduce it. We want all the employers to help all their workers go 100% online. Why do you think Arlington County Circuit Court is 100% online? Well, the judges are working from home because they don't want their judges to die. You know, yeah. You need to shut everything down. We have 6 months of death, exponential death coming. You need to shut everything down. President Trump got infected with COVID-19. Read my COVID-19 poem on President Trump getting infected. It's on my Twitter account for today. Just read it. And he may die from it this week. You know, I mean, don't be surprised if you turn on news tomorrow and that they said President Trump is dead. It could happen. I hope not. I like President Trump, but it can happen. COVID-19 kills, okay? And he's over 70. He's overweight. He can die from it, which is unfortunate, but it's true. And we have other people who are high profile who could die from it, like ex-governor of New Jersey, Christie. I think he has like 99% of chance of dying. I predict he's going to die like pretty soon. I mean, he could be on a ventilator and kept alive, and it's possible he could survive, but I don't think he has much chance of survival because he's really overweight. And he has asthma. I mean, geez, you know, that's like that combination. Um, yeah, so I mean, I'm predicting, you know, New Jersey Governor Christie dying this week, maybe, or next week. You know, I mean, if he's on a ventilator, he could prolong life. I mean, there can be miracle where he doesn't die, because if he doesn't die, it's a miracle. But I think he will die like this week or next week. Yeah, that's my prediction, Governor Christie. But you know, President Trump will die this week too, and we have 3 U.S. senators who got COVID. You have Mike Lee from Utah, Tom Tillis from North Carolina, and Ron Johnson. They could all die. You know, I mean, maybe not this week. They look kind of healthy. But you know, they could all die, you know, within a month. You know, we're entering flu season, so this is not like summer where people get mild symptoms. No, this is winter. You don't get mild symptoms; you get severe symptoms. Yeah, and it's only starting. It's only going to continue for 8 months. People are going to die and die and die and die and die. That's what you're going to notice. That's all you're going to be hearing about for the next 6 months. People dying from COVID-19. Um, Yeah, I mean, it's unfortunate, but it's a killer virus. What do you expect? It's a global pandemic. This is a joke? No. I created this show, COVID-19 Update by Heerak, to save you and your children from COVID-19. Why do you think I did this? Because you can die from it. I'm predicting that minimum 10,000 will die in North Arlington County alone during the flu season. Minimum 10,000. Because we're close to DC. There's a lot of movement here, a lot of people working in government, you know, and they're moving around, you know. Yeah, I mean, I think Joe and Jill Biden will get COVID and they may die from it. I mean, because anybody who's moving around, the chance of getting it is high. Let's read the relevant quote from this article. We wanted to continue fighting how a Reno grandmother, mother, and newborn survived COVID-19. It's from Reno Gazette Journal today, October 5th, 2020. Jenny Kane wrote it. And the quote is, just 3 days earlier, she had been admitted to St. Mary's Regional Medical Center, the hospital where she works as a monitor technician on the front line of the coronavirus pandemic. And that's like all nurses, all physical therapists, occupational therapists, respiratory therapists, physicians, you know, patient care techs, you know, well, you know, monitor technician, you know. It's not as dangerous of a job as a patient care technician, obviously. But because you're just looking at the monitor, but you can still get COVID, right? Because COVID-19 is airborne. So if you're working on a COVID-19 unit, it's just lift the mask once, you could get COVID, in a COVID-19 unit because it's airborne. At work, Nava did everything she could think of to keep from getting sick. Obviously, I mean, geez, I work in a hospital. Obviously, I'm going to do everything I can to prevent myself from getting COVID. You know what I'm saying? And that's not just me. It's like all my fellow nurses at Virginia Hospital Center, all the care patient techs. I mean, everybody's trying not to get COVID. I mean, who wants to get COVID? I mean, you could die from it, right? And there are 1,000 people dying every day in the summer, far more in the winter. Who wants to get COVID, right? So at work, Nadia did everything. And she's a, monitor technician. It's a safer job. You just look at the monitor. I mean, how dangerous can that be, right? Probably the most safe job in a hospital. Looking at the monitor, you're not monitoring patients. You're looking at the monitor. Yeah. And she needed to protect not just herself, but her older parents at home and her unborn baby. Nava was 20 weeks pregnant. So hearing that the virus might be able to live in hair, as you know, coronavirus can live in your hair. That's what the scientists are saying. And it can stay in the walls for like 3 days. So if you live in an apartment, you touch a wall, and then you touch your eyes, you will get COVID, according to the experts. And we call that indirect transmission of COVID-19. That's why they keep cleaning the floor, right? And ideally you should clean the walls as well, but because you probably touch the wall far more than you touch the floor. But yeah. So she needed to protect not just herself, but her older parents from home and her unborn babies. This is why I'm saying 3 to 20, more like 30 million people will die, because during summer, symptoms can be mild. And if you're physically strong and your immune system is strong, your chance of survival is pretty high in the summer. But during winter, everybody's immune system is lower. And there are all kinds of other things, cold, flu, and strep throat, and, croup, mononucleosis, that's hyperactive. So during the flu season, let's say you get infected because you're a teacher teaching at Fairfax County Public Schools. You come home and you have 3 children. They will all get infected. And then your husband will be infected. And all 5 of you can die. So in the summer, if you get infected, you may have mild symptoms. And, your husband may be very physically fit. Your children may be very physically fit, And so, maybe all of you will survive. It's not like that in the winter. In the winter, all 5 of you have high chance of dying. And that's why I'm saying it's idiotic for Fairfax County school board members to open up. This is what Democrats do. This is why I don't like Democrats. They're idiots. These Democrats are idiots. They don't respect science. They don't respect science. They just care about their Democratic Party platform. Democrats are idiots. That's why I've never joined the Democratic Party in my life. If you're a Democratic Party member, leave. Because Democrats are full of idiots. I'm independent candidate for U.S. Congress in Virginia's 8th district, as you know. I'm running against Tom Bio, who's a Democrat. So vote for me, to be your congressman, because you have too many idiots. Like most Democrats are idiots, in my opinion. The Democrat politicians, and that is clear from what Fairfax County is trying to do: open up schools before the flu season. Which idiots do that? I mean, you have no respect for science, Fairfax County. No respect for science. As a science teacher, I'm licensed to teach science. As a science teacher in public schools, you are trying to kill Fairfax County residents. It's not fair to them. They worked hard, especially immigrants in Fairfax. They don't deserve to die from COVID in the 6 months of flu season. Why are you opening up schools? Why are you opening up schools? Why don't you respect science, Fairfax County? Why don't you respect science? That's absolutely morally wrong, ethically wrong, what Fairfax County is trying to do. Kill their residents by opening up schools, because you have no respect for science. All you care about is Democratic Party ideology. It's like Joe Biden running around campaigning. That's why he's probably going to get COVID and his wife is probably going to get COVID. Yeah. So anyway, let's continue reading. Um, she needed to protect not just herself, but her older parents at home and her unborn baby. Nava was 27 weeks pregnant. So hearing that the virus might be able to live in her, she tightly braided her back and wore a scarf over her head. Maybe she touched the scarf with her hand and touched her eyes, right? Because you put a scarf, I mean, you can't touch it, right? I mean, you can touch it, but if you touch your eyes after you touch it, you get infected. Um, According to people who say you get it from, hard surfaces. Yeah, I mean, you know how hard, when you're taking care of COVID patients who are infected, you have to make sure you don't touch the surfaces of things that, you throw everything away in the room when you leave in a hospital setting. Because then you got to do what you can not to touch the surface, because touching the surface can get you infected. So, yeah, that's so. Care patient techs, nurses, they take a lot of effort not to touch the surface. And they have to wash their hands for like 20 seconds afterwards. Yeah, it's pretty serious stuff. Um, yeah. And there's a technique to do that, how to wash your hands. So you wash every little micro millimeter of your hand. Every time I mean, geez, yeah, it's pretty serious stuff. Um, So hearing that the virus might be able to live in air, she tightly braided her back and wore a scarf over her head. It's probably the scarf that gave her the COVID. Because you have to throw away stuff, right? But if she came in contact with a COVID patient in the hospital and she has this scarf, and if she touched the surface of the scarf and touched their eye, then yeah, she got it, right? So I mean, it's good to have disposable hair nets that you could just throw away and then wash your hands so you don't bring it back home. She could have brought the scarf back home and maybe her child or mother touched the scarf and touched the eyes and got COVID. You see what I'm saying? So, it could be the scarf. Um, that's why disposable things are better than like cloth, because, if you come in contact with somebody who has COVID and you touch the surface, like as you're throwing it into the laundry, you can get COVID. At Virginia Hospital Center, if you work in a COVID-19 unit where there are COVID patients, you have to wear a scrub. Like you come into hospital with normal clothing, you have to change into the COVID-19 scrub, like clothing. And when you're done with your shift, you put that like in a biohazard type of a bag, and then they like sterilize it to prevent you from bringing COVID-19 home to your children so they die. That's how serious it is. Like if you work in any unit with COVID-19 patients, you have to wear a separate. Hospital provides you with sterilized scrubs. You have to wear that. And that's how serious it is. Um, it's no joke. You have like a cloth mask, and somebody with COVID talks to you without a mask. You touch the outside, touch your eye, you have COVID. I mean, according to scientists who are studying this. Um, yeah. So she held her breath while changing out of tainted scrubs. Yeah, see, she's changing out of tainted scrub. Maybe in her hospital they require that too. Like if you work in a COVID, like you are given a sterile scrub in the beginning of shift. At the end of shift, you just put it in like a laundry towel has a laundry bag. Yet her efforts were in vain. Because all you have to do is touch the tainted part with COVID, touch your eye like you're like, fix your eyes is something is in your eye, you go like that, you have it. According to the scientists. So her efforts were in vain. In April, her entire household tested positive for COVID-19. Everybody in the home. But April, is tail end of COVID-19, and so it's not like getting infected in October. Probably all of them will die. Her entire household tested positive for COVID-19. Nava's mother um, was the first to fall gravely ill. So she still got seriously ill, even though it was like in April, till end of flu season. Um, and was admitted to the hospital the week before Nava went to the emergency room. So she's now going to the emergency room. Three generations of women, Nava, her mother, and her unborn daughter, would come head to head with a pandemic that has so far killed 200,000 people nationwide. So if you're pregnant, I mean, even if you're not pregnant, don't do it. You know, Fairfax County school teachers, don't do it. If you have money saved up, take the 6 months off. You know, it's not worth it. Or quit your job if you have to quit your job, and then reapply for another job. You know, I mean, or reapply to school district where have teachers teach online. I mean, geez, um, it's not hard to get a job, right? There's always a shortage of like teachers that, so yeah, I mean, Fairfax County School District is a very good school district too. So, you should have no problem getting a job if you quit. So I would say quit, if they're going to make you go in and teach and you have children at home, like, you know, yeah, quit. I would say quit the job. Just say you're resigning because, um, because of COVID-19, they're not being responsible, you know. Fairfax County had the greatest number of deaths and infections in the first flu season, and it was only tail end of it. I mean, this flu season, Fairfax County have the most deaths in Virginia. So you don't want to be part of the number. You don't want to be in that number. Yeah, so that's my recommendation. Obviously, you do what you want. I mean, if you want to risk the lives of your children, because obviously you're not going to get special scrubs in your, it's not like working at hospital. We get special scrubs, and there are hand washing stations everywhere. There are alcohol things everywhere, right? And then at the end of the shift, we like throw everything into the biohazard bag, and I mean, and teachers are not like that. I mean, you have no scrub, you're wearing normal clothing, you go home with normal clothing, like later with COVID-19. Of course, you guys are gonna spread it to your children. Yeah, so yeah, I mean, geez, Fairfax County schools don't know what they're doing. They don't respect science. That's the problem that I have with liberal Democrats. They have no respect for science. They have these liberal ideologies that govern them. Um, yeah, I mean, you should vote against Democrats because Democrats will ruin America because they have no respect for science. They only care about their ideologies. Um, they don't care about you. They don't like if you're a teacher, they know you could die, but they don't care about you. They only care about their ideology. That's why I don't like Democrats. Yet her efforts were in vain. In April, her entire household tested positive for COVID. And that's going to be like Fairfax County teachers and Fairfax County students and who go in for in-person classes. Nava's mother was the first to fall gravely ill and was admitted to the hospital the week before Nava went to the emergency room. Three generations of women, Nava, her mother, and her unborn daughter, would come head to head with a pandemic that has so far killed 200,000 people nationwide. I thought that needed to be read again because Fairfax County Public School teachers who are in Virginia's 8th district, you need to know that that's your destiny. Don't go in if you don't have to. You're going to be risking your children's lives by going in. I mean, that's a 100% guarantee that you're going to be risking their lives. Whether you get COVID or 19, I mean, not everyone's going to get COVID, but you are putting your children's lives in undue risk by going in and teaching at Fairfax Public Schools. Don't do it. Don't do it. I know that forum is due tomorrow. They gave you an extension. Say, no, I'm not going in. Yeah, I mean, don't do it. And don't risk your children's lives. Well, I'm glad you joined in. And I'm glad that I'm providing this public service, healthcare service, public health service to Fairfax County parents and teachers to save you and your children's lives from COVID-19. Because unlike Arlington Public Schools, which are being smart and not opening up, Fairfax County School District is being stupid and opening up. They're risking your life. If they open, tens of thousands of people more will die because of it. Tens of thousands, maybe even hundreds of thousands. Yeah, I mean, I'm worried for Arlington County because Fairfax County Public Schools are trying to open up. It's just risky behavior. We don't need that in flu season. We don't need that kind of risky behavior in our neighboring county. And I live in Arlington County. We don't need that to jeopardize our health in Arlington County. We don't need that. And so every one of you who are parents in Fairfax County, you should write a complaint to Fairfax County board members. Um, you should write to Fairfax County principal of your school. You should write to the school district complaining that they are putting your life in jeopardy. This is not right. It's not right. Yeah, I'll get more information for you to help you survive COVID-19. You need to know what's going on. Liberal media is hiding stuff from you. And your parents, your children, you may die because liberal media is like hiding stuff from you. And that's not right. That's not right at all. Because your lives are at risk. Yeah. Yeah. Nurses go into hospital knowing that they can get COVID anytime during 12-hour shift, anytime. Like people who are working with COVID patients. And they know that they could die from it. And I'm predicting that minimum 12 nurses will die at Virginia Hospital Center where I work. But not just Virginia Hospital Center, but Unova Fairfax Hospital, Unova Alexandria Hospital, Georgetown Metzler Hospital, Children's National Hospital, George Washington University Hospital, Sibley Hospital, hospitals in this area. Every hospital will have minimum 12 nurses die from COVID. Minimum. By Christmas 2020, minimum. Because you see how complicated this is. And I'm just talking about nurses. 12 nurses, RN nurses. I'm not even talking about technicians. Obviously, technicians will die too, but I'm just kind of focusing on nurses right now. But it's not that only 12 people who work at Virginia Hospital Center will die. 12 nurses who work at Virginia Hospital Center, 12 nurses who work at Georgetown Metzler Hospital, 12 nurses who work at Unova Fairfax Hospital, 12 nurses who work at Unova Alexandria Hospital, 12 nurses who work at George Washington Hospital, 12 nurses who work at Children's National Hospital, 12 nurses who work at Sibley Hospital will die. I mean, there's going to be far more who die who are not nurses too, because there are a lot of employees who are not nurses. You will see what I mean. I'll give you a monthly update and keep you informed of what's going on. And that's why I'm going to do a cheer for my CNL cohort members. As you know, I graduated from Georgetown University with a master's in clinical nurse leader on August 24, 2020. My program was over before August 10th, but the technical graduation date, since it's part of a university set that date, is August 24th. And 25 of us got CNL master's degree in my core, CNL 2020, clinical nurse leader. I'm predicting 25 minimum will die by Christmas, 5 minimum. From my cohort alone, 25. But it's going to happen with every cohort that graduated in 2020. It's going to be horrific. You'll see. Yeah, so I'm going to do a chair. CNL 2020. Yay! We graduated on 2020, August 24th, technically. And even if you die, you can put on your tombstone CNL Masters Georgetown 2020 August. Yay! Yeah, I mean, I'm not gonna lie to you. I love you guys, but I'm not gonna lie to you. You know just as well as I do. Your chances of getting COVID and dying is pretty high. Now that 20-year-olds can get infected and die from it. Yeah. Um, yeah, hopefully nobody dies, but I don't believe in Santa. I mean, I like to see Santa Claus and believe in Santa Claus, but I don't believe in Santa Claus. And this is show for adults, so no children should be watching this. But yeah, so yeah, I mean, I wish there were Santa Claus, but I know there isn't Santa Claus. I mean, so I wish I could say nobody's going to die in my CNL cohort, but that would contradict the science. That would contradict public health. That would contradict the current trends. So that would contradict the history of pandemics. So I'm not going to lie to you and say, nobody's going to die. People are going to die. Right? That's why I'm saying that minimum 5 will die from my cohort alone. But every cohort, not just my cohort, it's like all the 2020 cohorts throughout the nation will have nurses who work in hospital. You're gonna have people die. I don't believe in the liberal media that like this is like not that significant. It is significant. It's all over the world. It's a global pandemic. It's the first time we had this kind of global pandemic in 100 years. Jeez, take it seriously. Um, yeah, anyway, I mean, we need to have facts. It's by knowing the facts, we are able to survive, right? In any circumstance. If you don't have all the facts, you're not going to survive. That's why this show is important to me. Fake news doesn't give you all the facts. That's the problem, right? Fake news doesn't give you the facts. They hide stuff from you. Yeah. I hope that you'll be well and that your children will be well too. So I look forward to seeing you tomorrow. Bye.